one of the things I would like to highlight that has played out in this response recently has been how we manage contacts. And in the recent cluster of cases, there was rapid identification of contacts, and an attempt was made to interrupt or reduce their interaction with the rest of the members of the public. So putting them in designated facilities that have been established by the government so that they can be monitored for 21 days. So this measure helped to ensure that all the 8 new cases that were identified, there was no other secondary cases linked to them, which means that when they developed symptoms, they were alone. They were not in contact with other people, and that is a very important lesson. Of course, there are other critical issues, ensuring that we put the community at the center, ensuring that we implement prevention and control measures, but also being sensitive to the cultures and religious beliefs. And then we have seen the added benefit of medical countermeasures such as vaccines, as we saw with the approved vaccines against the Ebola virus disease, as well as other therapeutics like monoclonal antibodies. And these are things that are being tried so that we can reduce the case fatality rate for Ebola.
Let's turn to cholera. The African region has recorded the highest number of cholera cases. There have been multi-country outbreaks of cholera. What specific challenges are contributing to this trend?
Cholera, as we say, is a disease of lack. It happens in a context where we have the population doesn't have access to clean water, there are inadequate sanitation facilities, and therefore it thrives in that context. And there are a number of challenges within our region that have been contributing to more or less continuous outbreaks we have had since 2021 within the region. The number one are development issues. As we know, access to water and sanitation is a development issue. The second one is the climate. We have seen adverse climatic events. We have seen droughts in the greater Horn of Africa, but we have also seen cyclones and flooding in the southern parts of Africa. The other issue that is very critical is conflict and displacement. Currently, we have a number of conflicts that are active within the region, and we have seen a number of, when people are displaced, they no longer have access to safe water and sanitation, and therefore cholera thrives in that context.
What are the key gaps in treatment and response that need urgent attention?
We always say as WHO that in this day and age, nobody should be dying from cholera. And that's why we've set a benchmark that in every cholera outbreak, less than 1% of the cases should die. And what is the magic bullet for cholera? It is the rehydration. So ensuring that the fluids that they are losing, you are able to replace it. So the number one issue is the issue of lack of access, immediate access to the rehydration, to the treatment. You need a high amount of oral rehydration solution as well as intravenous fluids. And those intravenous fluids, you need to have them closer to where the populations are so that they can be able to use them. And of course, the clinical expertise.
Cholera vaccine is utilized to prevent. Production has increased to 6.2 million doses, according to report. Yet the demand still outspaces the supplies. What strategies is WHO considering to further boost production?
So the issue that we've had with oral cholera vaccines, which are a very good tool for prevention and control of cholera, has been that we only, as of this year, we still have one manufacturer in Korea that's making the vaccine. So, and there is limited capacity that they can produce in a month. And as you have rightly mentioned, we have a high number of countries that are having outbreaks. So the doses, every time the doses are being produced, they are being shipped out. So we don't even have a stockpile. So the immediate action that was taken initially was to suspend the 2-dose strategy, so that now we only use 1-dose strategy, so that at least we can spread the doses thin and ensure that the communities that need them are able to receive. But there has been ongoing engagement with manufacturers to be able to boost production. But as a region, we have also been advocating that we need to have manufacturing of oral cholera vaccine within the region, because we are one of the regions that's mostly affected. And we were excited when BioVac in South Africa did announce that they are making investments to be able to enable them to produce the vaccines.
How effective is the 1-dose vaccination?
So there have been a number of studies that have been done, and they show that the one dose strategy is effective. Because you know, when you get 2 doses, it gives you protection of at least 3 to 5 years. When you get the 1 dose, it gives you protection at least 1 year. So it's ideally supposed to be a measure that buys us time so that we address the water and sanitation issue. But it also helps to reduce the severity of the disease and helps us to interrupt transmission. So it's been a very effective tool once we are able to deploy it effectively early in the response and targeted at the hotspots where there are transmission ongoing.